Okay, so hi, my name is Arfi Sharma, and today I'm going to talk about mental illnesses or psychiatric disorders among intellectually or developmentally disabled individuals served by Ohio Department of Developmental Disabilities. Um, and the reason we chose this topic today is because we are presenting the same topic at an ADD conference, and we thought it would be helpful to present this here and get some feedback from you all so that we can improve this presentation furthermore. Uh, so can you go to next slide? Okay, so to begin with, we all know that mental illnesses are diseases or conditions that affect how you feel, think, or relate to other people or your surroundings. Um, it's an important public health problem. National Institute of Mental Health estimates that about 25% of US adults and 13% of American children are diagnosed with mental illness during a given year. Mental illnesses are also associated with chronic diseases, like diabetes, epilepsy, cardiovascular diseases, and it can result in poor quality of life. So the objective of our study was to quantify the prevalence of mental illnesses or psychiatric disorders among adults with intellectual or developmental disabilities served by Ohio DODD and to see how the prevalences changed over time. The second objective was to estimate the proportion of ID/DD individuals taking medications for mental illnesses. And the third objective was to know the most frequent mental illnesses that were associated with emergency room visits. Yeah. Can you go back slightly? So to meet our, hold on. Back. Yes. So to meet the first two objectives, we used national core indicators, adult consumer survey data, and to meet our third objective, we used Medicaid claims data from QDSS, which is Medicaid Data Warehouse. So what's NCI? Yeah. So NCI is a collaborative effort between National Association of State Directors of Developmental Disabilities Services and Human Services Research Institute. It conducts several different surveys every year, but we use their adult consumer surveys to analyze and get to the results of this presentation today. So adult consumer survey collects information on health conditions of people with intellectual or developmental disabilities, the services they receive, and how they feel about their services. So our study population for this study included a random sample of adults aged 18 years or more with intellectual or developmental disabilities served by the state of Ohio. And the data that we had was from years 2008-9 to 15-16. The mental health questions that was included in the survey was from the background section, and the answer to those mental health questions were collected by SSAs from the state records or by case managers. So these are the list of mental health conditions that were asked about in the survey. Mood disorders, anxiety disorders, behavioral challenges, and psychotic disorders. Mood disorders include depression, mania, bipolar disorders, etc. Anxiety disorders include obsessive disorders, panic disorders, etc. Behavioral challenges include illnesses like self-injurious behavior, aggression, pica, etc. And psychotic disorders include schizophrenia, hallucinations, etc. So before we discuss about the prevalence of mental illnesses in DD population, I want to show you some slides that shows the characteristics of our study population. So this slide is about it shows the average age of study population by year. You can see that the average age of our study population is pretty consistent, around 40 years. Yeah, next slide. So this slide shows the distribution of gender in our study population. The blue portion of the bar represents male. You can see that our population has slightly more males than females. Yeah. This slide shows the distribution of race in our study population. You can see that majority of our study population are white, followed by Black or African American, and only less proportion of our study population were other races like Hispanic, American Indian, or mixed races. So this slide shows you the prevalence of common disabilities or health conditions among our study population. And we have included only some of the major disabilities or health conditions that are more common in our population. And among the disabilities or conditions that are listed at the bottom of the slide, you can see that seizure disorder, the prevalence of seizure disorder was highest, which was around like slightly more than 25% of the population had seizure disorders. And the second most common disability was cerebral palsy, which is represented by orange line. And we know that the less common disabilities were Prader-Willi syndrome, chemical dependency. One thing to notice here is that the prevalence of autism spectrum syndrome increased from 14-15 to 15-16. We are not sure the exact reason for the increase in this prevalence, but it could just be because of the increased benefits of being diagnosed with autism spectrum disorder. It would be interesting to see how this prevalence looks like in the upcoming years. So from here onwards, we'll talk about mental illnesses in DD population. This slide shows the proportion of DD individuals with mental illnesses or psychiatric disorders. You can see that the proportion of people who reported to have mental illnesses have increased from 2008-9 to 15-16. In 8-9, around 36% of people had were reported to have mental illnesses compared to 55% in 15-16. One thing to notice here is that from years 8-9 to 11-12, the question they asked was, does this person have any kind of mental illnesses? But from years 12-13 to 15-16, they asked, does this person have mood disorder, anxiety disorder, behavioral challenges, psychotic disorders, or any kind of mental illnesses? So they had different variables for each of those conditions. So I create to analyze the prevalence for the years 12-13 to 15-16, I created a separate variable based on the answers to those questions. So we also wanted to know if the prevalence of mental illnesses varied by gender. You can see that the prevalence of mental illnesses was almost the same in males and females. The orange dots and the blue dots are pretty close together. The there was a slight difference in years 2010, 11, 11, 12, but I think those differences won't be significant. So this slide shows the proportion of developmentally disabled individuals diagnosed with different types of mental illnesses. You can see that the prevalence for mood disorder, which is represented by green line, is highest, followed by the orange line, which represents anxiety disorder, the dark orange. However, in 15-16, the prevalence for anxiety and psychotic disorder was like very close. We also tested if these prevalences were significantly different across years by using chi-square test, and the p-values that we obtained were highly significant. So we can say that the prevalence of these mental health conditions like mood disorders, anxiety disorders, behavioral challenges, psychotic disorders, and other mental illnesses or psychiatric diagnoses have increased significantly over time. And we don't have data from, so this question was new in the year 12-13. It was not asked in years before that, so we don't have data, we don't have information for the years before 12-13. So this slide shows the proportion of individuals diagnosed with mood disorder, anxiety, or psychotic disorders, and those who take medications for at least one of them. The red line represents the proportion of people diagnosed with mood, anxiety, or psychotic disorders, like any one of those. And the blue line represents proportion of people who take medications for those conditions. You can see that in years 13-14 to 15-16, about the same proportion of people were diagnosed with those conditions, and the same proportion took medications for the conditions. But in year 12-13, the proportion of people who took medications for the conditions were slightly higher than those who were diagnosed with the condition. So this means that some of the people who were not diagnosed with these conditions were taking medications for those conditions. So if you go to the next slide, this slide shows among those with mood, anxiety, or psychotic disorders, what proportion of them took medications for the condition. So you can see that a high proportion of people who were diagnosed with mood, anxiety, or psychotic disorders took medications for the condition, around like 80 to 90%. So if you go to the next slide, this slide shows among those without mood, anxiety, or psychotic disorders, what proportion of individuals took medications for the condition. And you can see that around like 16% of people without those conditions took medication for mood, anxiety, or psychotic disorders. And it seems to be decreasing over time. Like in 12-13, 16% of them took medications. In 13-14, 13%, and it's decreasing. Seems to be decreasing. If you go to the next slide. So this slide shows the proportion of individuals diagnosed with behavioral challenges and those who take medications for it. So the blue line is those who take medications for behavioral challenges. The red one represents those who were diagnosed with behavioral challenges. In years 12-13 to 14-15, about the same proportion of people were diagnosed with behavioral challenges and were taking medications for the condition. But in 15-16, the proportion of people who were taking medications for behavioral challenges were less than those who were diagnosed with behavioral challenges. So some of the people who were diagnosed with the condition were not taking medications for the condition. We also did chi-square tests to see if the proportion of people diagnosed with behavioral challenges were significantly different across years, and the p-value we obtained was very significant. So there was differences in the proportion of, like there was difference in the prevalence of behavioral challenges among DD individuals across years. So this slide shows among those with behavioral challenges, what proportion of individuals took medications for the condition. So you can see that about half of the people who were diagnosed with behavioral challenges were taking medications for the condition. So when you recall back people who are diagnosed with mood, anxiety, or psychotic disorders, like around 80% of them were taking medications. But for people who were diagnosed with behavioral challenges, only about 50% of them are taking medications for the condition. So, and this slide shows among those without behavioral challenges, what proportion were taking medications for the condition. So you can see that around 8% of people who were not diagnosed with behavioral challenges were taking medication for the condition. And this proportion is actually less than the proportion of people who were taking medication for mood, anxiety, or psychotic disorders. Yes. So this slide shows the percentage of individuals taking medications for mood disorder, anxiety disorder, or psychotic disorder by number of medications and year. You can see that majority of the individuals, so the N's in the top, at the top is the total number of individuals who were taking at least one medication. So you can see that majority of the individuals were taking 1 to 2 medications for mood disorder, anxiety, or psychotic disorders. And then about a quarter were taking 3 to 4 medications, and about like 7 to 9% of them were taking 5 to 10 medications for those conditions. So this slide shows the percentage of individuals taking medications for behavioral challenges by number of medications. As in the previous case, most of the individuals are taking medications for, like, most of the individuals are taking 1 to 2 medications. A quarter of them are taking 3 to 4 medications, and a very low proportion of them are taking 5 to 10 medications. So if you compare the proportion of people taking 5 to 10 medications for behavioral challenges with the proportion of people taking, if you go back, proportion of people taking 5 to 10 medications for mood, anxiety, or psychotic disorders, you can see that those taking 5 to 10 medications for mood, anxiety, or psychotic disorders are higher. Like here, 6 to 9% are taking 5 to 10 medications, but for behavioral challenges, like only 3 to 5%, 6% are taking medications, are taking 5 to 10 medications for behavioral challenges.
If you'd like to pause there for a second, Arti, I see we have a question, and we're sort of switching topics now. Someone has asked, how is behavioral challenge defined in the NCI data? Does a medical professional assign this diagnosis?
So, so the way the question is asked is, so does this person have behavioral challenges? And in the bracket, it says behavioral challenges include aggression, self-injurious behaviors, etc. So if the state record shows that the person has aggressive behavior, or they have like self-injurious behavior, then I guess the SSAs would check it as yes, that person has behavioral challenges. But if the state record does not indicate that those people have those conditions, then they won't be considered under behavioral challenges. So, so that actually, I don't know how the state maintains records of their diagnosis. I guess their diagnosis should have been done by the professional, and thus it gets into the state record. So I guess
might vary by county as well
on
how things are recorded and how things are tracked.
So yeah. So should we begin?
Yeah,
should we continue?
Move on. I don't think, are there any other questions? Can you tell? That's the only one I can see on there. Okay.
Can you go back? So next we'll talk about emergency room visits for mental health conditions, and we used data from QDSS, which is the Medicaid data warehouse, to obtain to know the frequency of ER room visits for mental health conditions. So first, we identified individuals who were actively served by county boards or were in ICF during the calendar year 2016. And then we looked for ER visits associated with mental health conditions of those individuals in the Medicaid data warehouse. We pulled the field called disease categories from QDSS, and this field actually, so a single disease category includes a group of, includes different related principal diagnoses. For example, disease category called sleep disorder may include sleep apnea, insomnia, hypersomnia, and other related sleep disorders. So these like the disease categories pulls related principal diagnoses together. So the total number of individuals that were served, that were actively served in 2016 or were in ICF and had a Medicaid number were 74,742. And the number of individuals who visited emergency room for a mental health condition was 2,742. So the percentage of DD individuals who went to ER for a mental health condition was 3.7%. So 3.7% of DD individuals went to ER for a mental health condition in calendar year 2016. So this table shows the number of ER visits for mental health conditions. On the left-hand side, it lists all the disease, not all, but what we perceived to be mental health conditions. The disease categories that we called mental health conditions, and those were depression, schizophrenia, antisocial personality disorder, other psychosis, bipolar disorder, like manic episode of bipolar disorder, generalized anxiety disorders, drug abuse, dependence, intoxication, major depressive episode of bipolar disorders, sleep disorders, Alzheimer's disease or other dementia, and obsessive compulsive neurosis. There could have been other mental health conditions, but when we looked at the disease categories, we found that we understood, like, we are not mental health experts, so we considered these categories. We only considered these categories in our analysis. So you can see that the number of ER visits for depression was highest, followed by schizophrenia. The second column shows you the number of individuals who visited ER. So for depression, 1,616 visits were made by 785 people. The third column gives you the ER visits per person, which actually shows that among those who went to ER for those conditions, how frequently a person went to ER for the same condition. So the ER visit per person for depression is 2, which means that among people who went to ER for depression, a person, on an average, a person visited ER twice. So you can see that ER visits per person for depression and schizophrenia are highest compared to other conditions. So a person is going to ER more frequently for depression and schizophrenia than for other conditions. The last column shows percentage of admitted ER visits. So, and this, it's highest for major depressive episode, for major depressive episode of bipolar disorder. So if you go to ER for major depressive episode of bipolar disorder, you are more likely to be admitted compared to other mental health conditions you listed here. So percentage of admitted ER visits was also higher for the orange ones, like manic episode of bipolar disorder and other psychosis. So this slide shows ER visits for drug abuse, dependence, intoxication, or overdose by substance type. You can see that ER visits for drug abuse related to alcohol is highest compared to other drugs like opioid, cannabis, cocaine, which really makes sense. And then visits per person was also highest for alcohol and cocaine compared to other drugs. And the percentage of admitted ER visits was high for hallucinogen, but there were only 2 visits, so I guess one of them was admitted. Yeah. So this slide shows the distribution of mental illness categories seen in ER visits among developmentally disabled individuals by age group. And I have only included individuals under 18 years of old here, because we were interested in looking at for what conditions kids are going to ER for mental health conditions. You can see that for age group 0 to 2, there were only 5 visits for mental health conditions, and they were for, it's hard to see here, but yeah, they were for schizophrenia, sleep disorders, generalized anxiety disorder, and conduct disorder. So there were 2 visits for schizophrenia and 1 visit for all others. For age group 3 to 5 years old, there were 8 visits. And then the visit for conduct disorder was highest, followed by sleep disorders. Visits for conduct disorder was highest, followed by sleep disorders. Among age group 6 to 17 years, there were 624 ER visits, of which visits for conduct disorders were highest, followed by depression and other psychosis. So to conclude, prevalence of mental illnesses or psychiatric disorders among developmentally disabled individuals increased over time. It was 36% in 2008-9 and 55% in 15-16. It's difficult to determine if this increase was an actual increase in the prevalence, or the difference was due to the difference in the way the question was asked across years. Regardless, the prevalence is higher than the National Institute of Mental Health estimate of around 25% of nationwide prevalence of mental illness. higher proportion of individuals with mood, anxiety, or psychotic disorders take medications for their conditions than do those with behavioral challenges. Depression and schizophrenia are the two most common mental illnesses associated with ER visits in developmentally disabled population. These people also tend to present in ER more than one time. So if our overall goal is to reduce the number of ER visits related to mental health conditions, focusing on people with these conditions would have the most impact. Finally, the limitations of this study. So for the NCI data, we know that we have a lower response rate from people who are nonverbal. So nonverbal people might have been less represented in our population. Also, DODD changed the survey vendors in 2015. So from in years before 2015, there was someone else who was Seymour. Seymour was administering the survey and managing everything, but from 15-16 onwards, it was given to Nisanger. The responsibility was given to Nisanger. So there could have been difference in the way the survey was administered and the information data was collected. So that could have accounted for some differences in the prevalence that we have reported here. For the Medicaid data, while most of our population does have Medicaid our study population is exclusively people with known Medicaid numbers. There may be some unknown differences between these people and the entire population that DODD serves. So that's one of our limitations. With this, I end my presentation. I thank you everyone for coming here and all those who are listening to this webinar. If you have any questions, I would be happy to answer.
Yeah, if you are listening on the GoToWebinar, please use the question box to enter your questions. I can't tell.
Oh, we have might be something.
I think the questions we have entered right now, okay, there's one, which was a follow-up, I think, to the one you answered before about whether behavioral challenges were assigned by a medical professional. She's asking if the medication, how someone determines that a medication is specific to a behavioral challenge.
So the question, like in the survey, they did not ask the question did not tell you to answer what the name of the medication, and the response, like we did not categorize the medications based on the name of the medication. It just says, did this person take medication for behavioral challenges? And it was up to the discretion of the SSAs whether they thought the medications that the people were taking was for mood disorders or not. So if they asked what medications are you taking and they had a list of medications, then we would have classified those whether they were for mood disorder or behavioral challenges. But since we did not have the name of the medications, we just looked at how the SSAs filled out the survey.
We have another question asking if you could speak a little bit more about the substance abuse information and if the substance abuse is on the rise.
So we actually, for the QDSS, we don't have it we have it only for 16, for the calendar year 16, 17, but we know that like chemical, we have, can you go up, like chemical dependency? We had a graph for chemical dependency. And it's like a very low proportion of our population have a chemical dependency, and I just want to see if it's changed over time. It's in the first, like around the first slides, like first few slides.
You can get out of presentation.
All the little lines.
So the blue line over here, it seems to be like higher in 15, 16, like chemical dependency, but we don't know if that is a significant difference.
It's still so close to zero right there that
yeah, it's very low. Like the prevalence of chemical dependency is very low in our population.
So this is a lot of work that Archie has done, but Abby, who is an intern, is in the room. She has also done a lot of work separately on specifically drugs, particularly opiates. And so I don't know if we've shared any of that with you yet, Connie, but once we have that ready to go, we can share that with you and make it available to everyone. Does that sound good, Abby?
Sounds great.
Here's another question. Does the increase in behavioral and mental health conditions coincide with increase in autism diagnosis? It seems like the two went up in unison.
So let me go back to so the autism increased from 14, 15 to 15, 16. Yeah. So it's a start rate was from 14, 15 to 15, 16. It's almost the same in 13, 14, and 14, 15, right? So it seems to be slightly higher in 13, 14 compared to 12, 13. But if you go to the prevalence of mental illnesses or psychiatric disorders slide, blue one, up, yes, that one. It's like increasing steadily from 11, 12. So I'm not sure if I can't tell you from these information that they are moving together. We'll have to look more into it.
Yeah, we could definitely do an analysis and look to see if it is related to the, in particular to the people with an autism diagnosis. But we wouldn't be able to say a correlation just from looking at what we have right now. Anything else? That looks like it. Thank you very much, Archie. This was really informative, and we will make the recording of this available out on YouTube.